Hi everyone, Dr. Bala here. We want to say welcome to the 17th edition of ICMFEL Medical Reality Talk Show. Today we are excited. We have joining us Mistress MELVINA Diamond ELLIOTT-SANKOLO, and we will be discussing the topic prevention of unintended pregnancy and sexually transmitted diseases. So we want to say welcome as you join us today, and we hope you will follow the program, and it's going to be a blessing to you. So keep tuned as we continue with the program. So it's good to have MELVINA Diamond ELLIOTT-SANKOLO with me today, and very interesting. We're gonna be discussing prevention of unintended pregnancy and sexually transmitted diseases (STDs). And MELVINA is an expert in this area because she has her master's in public health, and specifically, she did some work. Her entire thesis was about this topic, and so it's a privilege to have MELVINA with me today to discuss this topic. I know our generation, the young people, we talk about sex, we talk about pregnancy, but probably with ignorance, in a wrong way. And so it's good that we have this kind of conversation where we can be able to discuss and bring the facts about this topic out. So it's a blessing and a privilege to have you here today, MELVINA. Thank you so much for making your time to have this talk show with us today.
Thank you, Dr. Bala. Thank you for the opportunity to be on this platform. I don't take it for granted. Thank you.
So before we go directly into our discussion today, MELVINA, I don't want to start without setting this basis. So how will you define unintended pregnancy? What would be the definition of unintended pregnancy? So we want to talk about the prevention.
Okay, so unintended pregnancy is a pregnancy that is unplanned or unwanted at the time of conception. For example, a lady gets pregnant at a time where she's not ready to have a baby. She didn't plan to have a baby. She doesn't want a baby at that period. So in other words, unintended pregnancy is a pregnancy that is mistimed. That is, the pregnancy happened at the wrong time. So basically, that's unintended pregnancy.
Okay, great. So I think there are a couple of words I picked from that. She is not ready. She hasn't planned for this pregnancy, and it just happened.
Yeah.
So it's unintended. She didn't plan for it. That's one. Second, she don't even want it, and it happens, and that's unintended pregnancy. So if the your definition of before we go to the definition of sexually transmitted disease, let's talk a little bit about pregnancy and then we go on. So what are some of the risk factors of unintended pregnancy? You put it that way. Saying, I don't plan for it, I don't want it. So what are the things I should be careful that will probably bring me in that situation?
Okay. So there are a lot of risk factors associated with unintended pregnancy, but I'm just going to list key ones. So there are a lot of risk factors. Some of the risk factors associated with unintended pregnancy are inadequate access to family planning services.
Okay.
So sometimes in a resource settings, there are limited access to family planning services. That is, in a low resource settings, there are limited access to family planning services. Underprivileged people most likely do not have sufficient access to family planning services. As a result, there is an increased level of unintended pregnancy within that population. So lack of access to family planning services is a risk factor for unintended pregnancy.
So lack
And
of
another,
access, okay, lack of access
yeah,
to family planning
yeah,
services. Okay.
yeah, inadequate access to family planning services. So another one is lack of contraceptive use. So if you are sexually active and you are not on any form of contraceptive, if you are a male, you have a high chance of getting a woman pregnant. And as a female, if you are not on any form of contraceptives, you still have a chance of getting pregnant at the time you do not want to have pregnant. You do not want to get pregnant. So that is it. And another risk factor is low socioeconomic status.
Okay.
So there are a lot of research done on the relationship between low socioeconomic status and unintended pregnancy. And most of those studies concluded that low socioeconomic status is associated with unintended pregnancy. So women with low socioeconomic status are more likely to experience unintended pregnancy. And another risk factor also could be sexually active adolescents.
Okay.
So sexually active adolescent girls are more vulnerable to unintended pregnancy because they are at the stage where the excitement of sex comes in and they just go about engaging themselves in risky sexual behavior, which increase their chance of getting pregnant at the time they didn't want to get pregnant. So these are some of the key factors associated with unintended pregnancy.
Okay. So you could have access to family planning, but if it is inadequate, that could be a risk factor. Yes, like sexually active, uh, you know, group that are not on any contraception at all, whether male or female, that could, because you the male, if you're not on any contraceptive, you could easily impregnate,
Yes.
somebody who not prepared for it, right? Even sometimes in the male also not not prepared, right? And that could be the situation. And then adolescents may not have a lot of knowledge how to even work around the contraceptive, even if the family planning option is available, if the person don't have sufficient information to make better use of it. As an adolescent, that could also be a risk factor, right?
Yes,
And
yes,
then
sure.
you lastly talk about the social economic status. Okay, that's I think that's something we should pay attention to. Next question is, well, we know that you talk about the social economic status. In fact, unintended pregnancy will even make this situation worse, right? So I think how can we prevent that, especially making reference to many low and middle income countries where this particular uh, issue is prevalence, right? So if you said that unintended pregnancy is associated with low socioeconomic status, that means in countries with low median income, there will be a lot of unwanted pregnancy, unintended pregnancy, and that will even increase the poverty rate, right? So how can we prevent that? How people in that setting can be able to help, if not eradicate, but I'll say reduce, the prevalence of unintended pregnancy? What are some of the preventive measures you would talk about?
Yeah, first of all, I would say in order to prevent unintended pregnancy, the first thing to do is to abstain from sex. This is the best way to avoid
Well,
unintended pregnancy.
Melvina, let me interrupt on that. I'm not saying this is impossible, right? But you just mentioned sexually active adolescent, for example, sexually active, group of people who are not, on contraceptive. Well, I know, especially from religious background, especially Christian, we preach that, right? Abstinent, you should be married before sex. But that put into place reality. This is, I'm not saying impossible, but we find 11, 12 years of getting pregnant. So that tell you how early did they start having sex. So do you think abstinence is number one on your list for prevention?
That I would say because that is the best way to avoid unintended pregnancy. But
Abstinence.
then we have other preventive measures too. So another one is access to contraceptive services and reproductive health education.
Okay.
So there are a lot of health facilities around that offer these reproductive health services. So as a sexually active person, you can just visit one of those hospitals, clinics, or maybe any sexual and reproductive health service center. And then there are so many methods of contraceptive that one can decide what to choose. So if you go there, there will be a lot of healthcare providers. Family planning services, and you're going to get the best one that suits you. So having access to contraceptive services and reproductive health education is very important in preventing unintended pregnancy. Another one is correct and consistent use of contraceptives. This is one of the effective ways to avoid unintended pregnancy.
So
as a sexually active,
let me come in a little bit, MELVINA. I know you continue using the word contraceptive for the laymen and ordinary people following us. What are some of the contraceptive you're talking about here? What is contraceptive in the first place? Maybe some people just hear that big word, contraceptive, like, okay, what is she talking about? They said, you know.
So, yes. So contraceptives are methods or devices that are used to prevent one from getting pregnant.
Okay.
We have so many types of contraceptives.
Condom.
We have the intrauterine device, that is the IUD, injection, implant, and there are a lot, I think about 9. So
Okay.
there are a lot of different contraceptives that can help.
Yeah, so that was good to bring out. So condom for a condom, but they may not know whether it's a contraceptive, right? Yes. Okay. Yes. Continue from there. So prevention, like using contraceptive, like you said, and abstinent. What else would you want? The best is abstinent. Yeah, ew.
Yes, I would say that. Yes, I would
Yeah. But okay, but let me come in here again. There could be people who are in stable relationship, married people. Do you think married people will also experience what they call unintended pregnancy? They're married, but they don't want pregnancy. They're not prepared for it.
Yes.
Yes, so
Yes,
in that case,
possible.
they still want to have sex, right? They still want to enjoy their married life. For example, maybe quite young and they're just getting married and like, no, we don't want to have kids now. We want to use our first 3 years and just enjoy our marriage, have time to ourselves. So in that case, if pregnancy occurred, that definitely unwanted, like, unintended, like, wow, even though we're married. So we're not limiting this just to, teenager or people who are not legally involved into sex. So even people who are legally involved into sexual activities could experience what we're talking about. That's what we say unintended. So you don't want to get pregnant, right? What do? So I don't know whether in that case, like married couples, abstinent could be a best option because they would want
it's
to.
not.
Yeah. So contraceptive
It's
maybe
not.
becomes their choice, right? But I like what you said, that consistent and correct use. So because there are people who are also using contraceptive, but using it the wrong way, right?
Exactly.
And
Exactly.
sometimes they are not consistent, and then pregnancies still come. So let's go on, and at least we have laid the basis on that whole pregnancy thing as well. So what would be your definition of STDs? What is sexually transmitted disease?
So sexually transmitted diseases are infections transmitted from and sexually transmitted diseases are infections transmitted from an infected person to an uninfected person through sexual contact, which could be vaginal, anal, or oral sex. So basically, that's
But
sexually transmitted.
so you say from an infected person to an uninfected person. Why, if both of them, the male is carrying an infection and the female carrying infection, and they infect each other? What will you tell
Yeah,
that?
so yeah, it's also STDs. That's it.
Yeah.
They are going to transfer sexually transmitted disease to another person.
Yeah.
So,
So basically,
and
these are infection we get from
yes,
another person through sexual
contact.
means, right?
Yes.
Whether through oral, anal, or vaginal. Yes.
Mhm.
So what are some of the risk factors as well for STDs? What?
Some of the risk, so some of the risk factors for STDs are having unprotected sex.
Unprotected sex?
Yes. So sometimes you don't know the health status of your sexual partner. You just go about, being so free to have sex with that person, and that person might be infected. So having unprotected sex with them, definitely you stand a high chance of acquiring STDs. So another factor is having multiple sexual partners.
Okay.
People,
Unprotected
people
sex,
who have,
multiple sexual
yes,
partner.
yeah. People who have more than one sexual partners are more likely to acquire STDs. And those people, honestly, they are very risky in society because they're just going to transfer infection from one person to another. So having more than one sexual partners is a risk factor associated with STD. Another factor is substance abuse.
Okay.
Substance abuse exposes a person to engage into risky sexual behavior, such
So when you
as,
say sister and when you say sustained abuse, MELVINA, what do you mean? Can you break it down?
I'm talking about alcohol or drugs abuse.
Okay.
Yes. So it exposes a person to engage themselves in risky sexual behaviors, such as having unprotected sex, having multiple partners, and even having casual sex. Substance abuse influences men
What
and
what would be
women.
your definition of casual sex?
Like, that's why I'll go on, don't worry. So like casual sex, some people you just meet a person today and you don't know the person, but because you are influenced with alcohol, you just go and have sex with that person. So substance abuse influences men and women to have casual sex, that things that they will not do when they are under normal condition. So it influences them to do it. So basically that's what substance abuse does. And another risk factor is rape.
Great.
Sometimes the rapist has an infection, and then while he rapes a person, that person too might have the same infection that he has transferred to them. So rape is another factor associated with unintended pregnancy. The victim can get infected through rape. Another one is being sexually active. If you are
So
sexually active,
being sexually active is a risk factor.
that's a risk factor. That's a risk factor because sexually active people, they are more likely to acquire STD. They are more likely to not use condom. So not using condom, you are
They're
susceptible to
exposed.
acquire STD. And another factor could be low social economic status.
Okay, so
Like I
almost they're
said,
kind of connecting to unintended pregnancy.
yes. Like I said earlier, people with low social economic status are more likely to experience unintended pregnancy and STDs. So low economic status is a risk factor associated with STDs. So that's, yeah.
Thank you. I think that's a rare exhaustive list. And so let's go on. What will you advise in terms of how can we prevent sexually transmitted diseases? How can we prevent
So I'll also say to abstain from sex.
that? Excellent.
That's what I'll say. Yes.
So
So
if I may ask, so unintended pregnancy in STDs are kind of really related here in terms of risk factors
yes,
and prevention.
yes, yes. So you have to abstain from sex in order to prevent STDs. And you should stay with one uninfected partner. So staying with one uninfected partner is the best and reliable way to avoid STD, because you just have that person and you are not going outside. So whatever that happens, obviously maybe before you can get children, but it's more safer to stay with one person than to have more than one partners. And another one is to use condom correctly and consistently. Condom is the most effective way to avoid STDs. Condom is the most effective way to avoid STD. Condom, there are all other contraceptives prevent you from unintended pregnancy, but condom is the only contraceptive that prevents you from both unintended pregnancy and STDs. So using condom,
so condom play a double role here. Yeah, it prevents pregnancy, unintended pregnancy, and also prevent STDs.
Yeah. So another factor too could be, another preventive measure is to avoid substance abuse. Like I said, it influences you to do things that you're not supposed to do, especially to have sex. So, because a lot of people always say that whenever they maybe taking alcohol excessively, they feel like they want to have sex also. So, in order to prevent STD, you have to avoid substance abuse. And I will also say sex education.
Okay.
Sex education is very important. We need sex education in schools, at workplaces, and we just need it on the radio, whatever.
So like we are doing, somebody could learn from this show.
Yes. So like sex education helps you to know your sexuality. It makes you to decide your reproductive choices. And you're gonna know through sex education that sexually transmitted diseases are harmful, and you're gonna know the risk factors, the preventive measure, So if you know these things, there'll be no way, even if you try to do them, at least you have that mindset that, oh, if I do this, I'm going to get this. So sex education is very important when it comes to preventing STDs.
So what would be your party statement as we close this talk today?
Okay. So I would say unintended pregnancy and sexually transmitted diseases among young people continue to be a sexual and reproductive health challenge. However, correct and consistent condom use is the most effective way to prevent unintended pregnancy and sexually transmitted diseases. All contraceptives are effective in preventing unintended pregnancy, but condom, like I said, is the most effective contraceptive that prevents you from unintended pregnancy and sexually transmitted diseases, making condom superior over all other contraceptives. So it is evident that many young people are sexually active. The fact that condom is the only contraceptive that prevents one from unintended pregnancy and STD, there is a need that young people be knowledgeable about the risk factor involved in sexually transmitted diseases and unintended pregnancy, and also to know the advantages of having safe sex practices. So let us, as young people, let us use condom as our best choice in preventing unintended pregnancy and STD. Thank you.
Thank you. So let us, as young people, use condom as our best choice to prevent unintended pregnancy and STD. That was the parting statement of Melvina. Thank you so much, Melvina, and it's a privilege
Thank
having you
you.
with us.
Thank you, Dr. Balan. Thank you so much.